Hello and a very good afternoon, all of you. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be doing really good. Today, we are doing this special Instagram live on a subject which is so close to all our hearts. We would be shedding light over a condition which affects millions worldwide. Yeah, I'm talking about acne, and today in this Insta Live, we'll be talking about acne management, and we'll try to understand what is acne, why it is caused, how to deal with it, what to do, and most importantly, what not to do from an expert. And today, our expert is going to be Dr. Dimple Doda Modi, who is a renowned skin expert from Thane, Mumbai. Dr. Dimple Modi is MBBS, MD Dermatology, and is a skilled dermatologist with expertise in dermatology, cosmetology, trichology, and dermatosurgery. She completed her MBBS and MD in dermatology from Maharashtra University of Health Sciences and underwent a senior residency at Nair Hospital, Mumbai. She further specialized in trichology with a fellowship under the renowned hair transplant surgeon, Dr. Cosmetic and surgical procedures. Dr. Dimple Modi excels in earlobe repair, mole and cyst excision, scar revision, Botox, etc., etc. And she has conducted extensive research in trichology and authored a comprehensive thesis on fungal nail infections as well. Known for her precision and patient-centered approach, Dr. Modi is dedicated to providing high-quality care tailored to her patients' needs. And today we'll be talking with her on acne management. Now, acne is something which affects so many people worldwide. And I often say acne is just not a skin related or a surface related issue. Deep down, it do affects our self-esteem, our confidence level. Many times people who have this chronic acne condition goes into depression. It's that severe. So it's important to talk about acne and to understand why is acne formed or what are we doing wrong for which we are, more prone to having acne, especially for those who have acne-prone skin or who have oily skin, and especially for those, who are in their teens, adolescents, young adolescents. They find it so difficult to deal with it. And here we go. We have with us Dr. Dimple Modi. A very warm welcome to you, Doctor.
Good afternoon. It's my pleasure to be on Beautiful Spotless Skin.
It's a pleasure for us as well, Doctor. And today we are going to talk about such an important topic which affects people worldwide, So it becomes so important to talk about it and know the nitty-gritties of it. To start with, Doctor, क्योंकि acne पे हम बात कर रहे हैं और ये सिर्फ स्किन रिलेटेड एक इशू ही नहीं है. डीप डाउन वो हमारे सेल्फ एस्टीम को, हमारे कॉन्फिडेंस लेवल को भी बहुत बहुत तरीके से हैम्पर कर सकता है. बस में बहुत जरूरी है कि होलिस्टिक वे में हम इस पर बात करें. To start with, Doctor, what is acne? Why it is formed?
See, acne is basically blockage in the sebum ducts that help to maintain the skin this oily that help to maintain the skin cut pH and texture. Okay, so whenever there is a block in pilosebaceous ducts, acne is formed. So the reasons could be anyway with stress, irregular diet, irregular sleep, lifestyle, mostly irregular, irregular androgen circulation. There is excess of androgens in the blood which are circulating, which trigger acne. Now, how are those androgens excessively produced and circulated? It's because of our high fatty diet. Also, one of the contributing reasons is bacterial inflammation, which is Propionibacterium acnes, which is a very common bacteria found on face, which causes pustules and acne. That is responsible. Again, we have to regularly cleanse our face. That's the basic tip. Further, I'll discuss more tips as we go ahead.
Definitely, Doctor. And as you said, n number of factors could be responsible for acne formation. And because we are talking about acne, as a layman, we see many times those whiteheads or blackheads, what we call. Then there are this big, bumps on our face. Then many times they are very painful, a lot of inflammation happening. Many times they are really big in size. and that makes the condition even more worse. So what are the various type? क्या क्या type होते हैं acne के और कितना worse acne हो सकता है डॉक्टर?
See, there are basically four grades of acne. The first grade is comedonal acne, जिसे हम normal language में white heads और black heads कहते हैं. Now black heads are open comedons. वो ducts जो रहती है वो open रहती है, उनमें dirt deposit हो जाता है, इसलिए वो black दिखता है. White heads are closed comedons. उनकी ducts closed रहती है, तो इसके लिए वो ये रहता है. These are एकदम grade 1 basic kind of acne जो बहुत basic topical treatment, topical retinoids को respond करते हैं. वो बहुत
Right.
कॉमन एडोलेसेंट एज में होता है एंड इट्स अ प्राइमरी काइंड ऑफ थिंग जो शुरुआत जिसे हम कहते हैं वो है. देन देयर इज योर ग्रेड 2 जिसमें छोटे छोटे एक्ने रहते हैं. सम ऑफ देम आर पस्टुलर, कुछ कुछ ये रहते हैं. ग्रेड 3 एंड ग्रेड 4 आर अगेन नोड्यूलोसिस्टिक एक्ने. ग्रेड 4 इज विद एक्ने स्कार्स एंड बहुत सारा जब आपके चेहरे पे सिस्ट आता है, बहुत सारे पस्ट्यूल्स आते हैं, इट इज रेड इन्फ्लेम्ड, प्रॉपर इन्फेक्शन हो जाता है. दैट इज ग्रेड 4 एक्ने. ट्रीटमेंट हर चीज का वेरी होता है. ग्रेड 1 ग्रेड 2 यूजुअली टॉपिकल ट्रीटमेंट को रिस्पॉन्ड करते हैं. ग्रेड 3 ग्रेड 4 जनरली रिक्वायर सिस्टमिक रेटिनॉइड्स होता है, सिस्टमिक एंटीबायोटिक्स होता है, समटाइम्स केमिकल पील्स या अदर टाइप ऑफ सर्जिकल मोडालिटीज प्रोसीजर्स होते हैं. तो these are the basic grade 4 four types of 4 grades of acne.
Okay, fair enough, doctor. Doctor, acne is one thing, and dealing with the post-acne inflammatory marks and scars, those pits, big pits, they look like the bigger
Very bad,
challenge.
very bad.
और वो ना
Treat your acne at a very early level at grade 1 and grade 2. Don't wait कि अपने आप चला जाएगा. Most of the patients coming to me say कि अरे हम लोग इतने दिन से बैठे हैं, जा ही नहीं रहे. How will it go if you don't take a treatment? And then that Instagram and Nykaa craze is unnecessary, irrelevant, and those people have been very pro in marketing their niacinamide and snail mucin because people really don't know what to apply. They just see the reviews. This is good. Snail mucin is good. Collagen is good. Niacinamide is good. You don't know anything about niacinamide. Why do you want it? And then there is excess of scrubbing. I tried this. I tried that. There is people come with such bad flair and such bad faces that it takes a while for us to correct them. So we would just request people that if you don't know, please don't do anything. Just see a dermatologist and report when it's a grade 1 or grade 2 because grade 3, grade 4, they leave very bad scars and then the treatment is equally complex with all kinds of lasers and IPLs. It also burns your pocket. And besides the pain and the number of sessions you have to go through.
And that was the reason I asked you about the various grades. So we know that, this is the time when we need to go and contact with a qualified dermatologist like you and get it treated. And of course, lesser the chances of having post-inflammatory, post-acne marks and scars. But doctor, as you said, even I would like to draw more attention to this topic of home remedies, DIYs. As you said, these days Insta, on other social media, there are so many influencers. In a way, they are making money out of it because they are endorsing, various products. But we as people are falling for it. We are buying like 50 bottles in the name of regular skincare regimen, and we don't know what to do with it. We are doing peelings at home. Chemical peels are being done at home. Right. So, and then of course we have that easy access to chemist shops कि भैया कुछ हो गया कुछ दे दो the topical cream that we normally get and we keep on applying it. So we would like you to shed some more light over these home remedies, these DIYs, these over the counter topical applications like n number of products. वो हमारी स्किन को स्पेशली एक्ने प्रोन स्किन के लिए कितना खतरनाक हो सकता है, थोड़ा डिटेल में अगर आप हमें बताएं.
Strictly no to DIY and home remedies. Your basin dries up your skin, causes acneiform eruptions, unnecessary bumps आ जाते हैं. मसूर की दाल and उसका scrub करने से आपका oily skin से और breakouts trigger होते हैं. DIY masks, you don't know what suits for you, what does not suit for you. First of all, you don't know your skin type. Even if you know what your skin type is, it's oily, it's dry. How will you figure it out what's good for your skin? It took years for us to figure it out what suits for your skin. And secondly, those Mama Earth products, those instant pimple patches, and Pilgrim and Dot and Key products, and these are the names I can recollect. The common ones that those come to me, the serums that they apply, those are not for you. The serum may be good, but there must be some preservative, there must be some chemical which might irritate your skin. It may leave like irreversible damage, and it becomes very difficult for us to treat them. So say no to Colgate paste. People apply Dettol.
Mm.
We've had variety of things that people have applied on face. Chuna and just isne bataya, usne bataya. It's very dangerous. Do not do anything because it's your face. Ultimately, no doctor can correct it beyond a certain level. Don't fall for it. See a dermatologist. Make sure that your dermatologist is a board certified diploma, MD or DNB in dermatology. Anybody who's uh, anybody who's claiming to be a cosmetologist or a skin specialist, do not fall for that also. Just check for degree. Always check for degree. Do not also go by only reviews. Just go by word of mouth. If some patient has been to that doctor, believe that more than the reviews, because the reviews can also be fake these days. You have to check to your also and check your doctor's credentials, the degree, and everything. Lot of people are practicing cosmetology. They are not even MBBS. Forget dermatology specialist. They do anything, and everybody does not need a hydra facial, a carbon peel, a snail mucin facial. It's not for everyone. If you're acne-prone skin person, less is more. The less you fidget with your skin, the better it will be. Sales people who
Right.
are
There is
wanting to
a
make
comment
money,
already. There's a comment already that lemon juice on the face, because it's again very common. People use lemon
very
juice
well.
on their face and they go to the doctor then with burned skin. So,
Absolutely.
right. So please refrain yourself from over-the-counter medication, self-medication, buying 50 bottles of, experimenting with your skincare regimen. As we are talking about skincare regimen, doctor, we all know it's important to follow a skincare regimen. लेकिन आजकल again market में, Korean skin, या इस तरह के बहुत सारे gimmicks हैं, market gimmicks हैं, and people are ending up
It's
buying
a
a number of
very,
things,
they have a
experimenting a
very
lot.
extremely good marketing PR that they are selling some things which people even don't know. So the marketing PR, I give a hats off to the PR that they are very successful. What we can't sell to our patients, what we are not, they'll come and question us if this sunscreen is good for us or not, but they'll not question or even think about it. So the PR needs a hats off.
So, what is a very minimalistic, basic skincare routine that we can be more consistent with, keeping in view that we are talking about acne management, doctor?
CTM is not recommended. Cleansing, toning, moisturizing is not recommended because of the toning thing. Toner particularly makes your skin dry. So what we recommend is CMS, cleanser, cleansing, moisturizing, and sunscreen. A basic cleanser, depending upon your skin. If it's oily, then probably a salicylic base. If it's dry, then probably a very basic cetyl alcohol based gentle cleanser for your skin, followed by a moisturizer in the morning with a very gentle SPF of 30 is also fine. Not everybody needs an SPF of 50, because if SPF 50, again, those are not so cosmetically elegant, and we don't need that high SPF unless you're photosensitive. Normal person needs an SPF of 30 is fine with a moisturizer, is good for if you're going out. Why the whole day, and above that you can apply your compact, your powder, whatever, just to make sure that it sticks and the dust doesn't come and stick to your skin. While coming back from work, just wash your face and apply moisturizer, or you can apply a vitamin C serum at night, or whatever any of your actives you can apply. Very basic, nothing in between. Just hydrate yourself well. Avoid more of coffees, avoid fried food especially, and avoid outside food as much as you can. People just binge, and even those green teas and healthy cookies and your healthy dips, breads of all kind, those multi-grain breads, those are all gimmicks. That's all shit. Have your stick
Right.
to your basics, pohas and idlis and dosas, and stick to your home cooked food with ghee. Baki rest all is just marketing gimmick with a very good PR. They are very successful these days in selling their stuff.
Completely agree with you. But then, as you mentioned, CMS, cleansing, moisturizing, and sunscreen application. I like to talk about them one by one and also the myths that, people often believe in. First of all, with cleanser, people who have a oily face or an acne-prone face, they feel that it's because of the excessive oil, production that they are having
Excessive
acne or they
androgen
have a
production.
dirty face, and they keep on washing their face every now and then with a
Yes.
cleanser or not a cleanser.
Yes.
What's the
You
right
just
thing to
need to
do?
wash not more than twice per day. Not more than twice. Even if your face is oily, you can keep a clean tissue and dab the excess oil. But washing face excessively will damage the pH of the skin, will damage the skin barrier, and then that will again contribute to your skin being more sensitive and creating more damage. So not washing the face with a cleanser beyond 2 times. More than 2 times is absolutely not.
Okay. And with moisturizer, again, people who have a oily face, they feel that they are already producing so much of sebum and thus they don't need a moisturizer. And normally, oily skin or acne prone skin people avoid using moisturizers. Your take on that?
See, basically, moisturizer is needed to restore the skin barrier and to maintain it. If your skin is very oily, you can use a gel-based moisturizer or probably a very light moisturizer. You can use only once a day. That's also fine. Not very heavy moisturizer. A light gel-based moisturizer is fine because once you wash your face, there is obviously a slight dryness. So just to restore it, a very gel-based or a light moisturizer also works. Once a day also works. More of it we recommend during winters. Summers may your sunscreen if it's hydrating, that's also fine. But
Right.
it's a myth that oily skin hai, so you should avoid moisturizer. Your moisturizer should be according to your skin type. Don't buy any moisturizer.
Right. And with sunscreens, there are so many confusions and questions people have, and probably that is the reason that in our country still 69-70% people are not using sunscreen on a regular basis. Now, my question to you, doctor, is that many times people will say that it makes my skin more oily, more sweaty, more patchy, more dull, and thus we are not using
See,
sunscreen.
that is
So,
that is
back
where
to
your
you.
moisturizer is needed. Because your skin is dry, if you apply a very dry sunscreen, gel based, it will look patchy and dull. Na? That's where your moisturizer works. It gives you a base. And also what sunscreen suits for you, that your dermat will decide. You pick up SPF 50, any product, you don't know if it suits you or not. If it's a concealer based, if your skin, suppose you're dusky, most of the Indian population is dusky. If they buy very SPF 50 fancy sunscreen, it leaves a white cast on their face. It looks very bad. So for them, we have tinted sunscreen so that it gels with their complexion. So it's variable. Gel based is usually used for a dry skin. For oily skin, we usually use the silicone uh, based sunscreen. So it's very subjective. It's for your skin as depending on your complexion, on your skin type, how photosensitive you are, how much exposure is needed, whether you are a work from home person or working outdoorsy kind of person. The sunscreens are different for pediatric age group. We recommend 19 SPF sunscreen for pediatric age group if they are playing outside. We recommend SPF 50 for photosensitive and 65 and 90 and the sunscreen which SPF 100, those are particularly not needed. SPF 50 is fine for the matter. If you're not photosensitive, SPF 30 is also okay. Rest everything is marketing gimmick.
When you go out to buy a sunscreen, even if it's a medicated sunscreen, there are so many informations on the box, starting from SPF, you have already briefed us about. Then we have this PA+++, and boot star rating, and whether it's a broad spectrum or not,
We
etc.,
need a
etc.
broad
What are the
spectrum
basics to go
sunscreen.
for?
We need a broad spectrum sunscreen which covers UVA, UVB, and UVC. UVB is considered with a higher wavelength. So we need a broad spectrum sunscreen. is again considering UVA rays. UVA rays are not here much. Matlab, they don't contribute to the percentage is very less. So we need a broad spectrum sunscreen.
Okay.
Basic
Right.
sunscreen, SPF 30 for acne-prone skin, SPF 50 for anti-aging, and if you are photosensitive or you have any pigmentary disorders with photosensitivity.
Fair enough. Doctor, when a patient comes to you with acne issues, are there any tests that you normally recommend for proper diagnosis?
So, I'm sorry, test for what? Diagnosing what?
To diagnose the root cause of acne formation, is there any
Yes.
test that you normally
Yes.
recommend?
We normally elicit history taking, diet, lifestyle. Sometimes most of the reason is stress, not eating their meals properly. Skipping breakfast is one of the major and most common reasons. Okay, skip breakfast. I don't have time to eat breakfast. I don't. I just eat. I just have coffee in the morning. I am a late waker. And these are the most common triggers. Binging at night, ordering Zomato, Swiggy every now and then, midnight meals, and all these are the history taking most. Then again, weight. The obese the person is, their hair growth on chin and their hair fall. These are the most common history, and lifestyle and clinical examination mostly tells us about everything. Apart from that, blood test may we do it to rule out polycystic ovarian disease (PCOD), but it's not the usual one. Most of the time it's just history and their lifestyle, sleep, makeup, what do they eat, how do they that is when do they sleep, their sleep cycle, how many hours they sleep, what time do they sleep, their screen time. That is more important. Also, their protein intake, their protein powder intake, their supplement intake also contributes to acne. So you have to tell them whey protein, don't take 2 spoons, just take half a spoon, and don't take too much of multivitamins. They'll also cause acne. And know what you consume, know what you eat is very important. Just because
Okay.
Health OK capsules has a very good rating on Amazon, you really don't know whether you need Health OK or not.
Right, right. People are also falling for these gummies, that will make
Gummies,
your skin.
gummies have a very high sugar content. It's another marketing gimmick. So sorry, the probably the marketing people may not like what am I saying, but it is what it is. The gummies are not. They are sugar content is high. The colors and the preservatives are not recommended. Your simple, basic calcium tablet. I'll not take any brands. Vitamin D supplements and iron supplements are absolutely fine as far as supplements are concerned. Your collagen and everything you get from a good diet and a good healthy exercise is recommended. Rest everything is taken.
Fair enough, fair enough. And Doctor, talking about the treatment part, what are the treatment options and what are the procedure that we have for acne and acne marks and scars?
See, there could be a lot of procedures. So starting basic from comedone extraction to chemical peels to IPL therapy, there is intralesional steroid injections. To for acne scars, we have erbium YAG laser, we have MNRF for scars, we have CO2 laser. The myriad and the options are endless. So it's very subjective on person to person what exactly he needs.
Right. And if we talk about these acne scars and pits and marks, so are they just the procedures or
Yes,
even there
I
is
didn't get you. Which procedures you said?
for post acne marks and scars and pits, are there any medication that works or creams
No,
that works or it's
no.
just the
Acne
procedures?
marks, pit scars, nothing works. No creams, no tablets, straight procedures. That procedure,
Okay.
which one? It could be simpler to complex one. That depends on your doctor, what call he takes. But if there are scars, it's hugely unlikely that they'll go away from creams.
Hmm. Okay. Now, because we are continuously talking about the market gimmick, etc. We also have this tendency of, for example, I have acne and I'm discussing the same in my family or with my friends. one of my friend or family will come up and say, see, I also had acne. I went to the doctor. Here's the prescription. Go with it. Get the medicines, get the, things and start medication. So why don't it work that way?
No, you don't know now how's his skin and how different is your skin. Why you have to follow his prescription? His skin is oily. He has given an oil moisturizer for oily skin. He's given him the sunscreen and face wash for oily skin. Your skin is combination type. You'll try get up more acne just because you want to save some 400-500 bucks of visit to a dermatologist. That will cost you later. So
Right.
never follow fellow prescriptions.
And everybody's problem, grassroots cause, etc., differs. So we
See,
need an individualistic approach.
nothing can give you a quick fix. You have to visit a dermatologist sooner or later. The earlier you visit, the better it is, because the later you visit, it will pinch your pocket even more. Either you buy the product initially, use it, and then throw them away, or damage your skin. That's even worse. It will pinch your pocket eventually. So it's better earlier the better.
Right. Now, doctor, many people ask about makeup. If, for example, I have a acne-prone skin, can I do makeup? Then, many times makeup is a professional necessity. For example, for air hostess, for actors, for anchors, etc. It's a necessity. What in case they have acne or have an acne-prone skin
Acne
and they
prone
want to go for makeup?
Acne prone skin, if makeup is a necessity, you have to do it. Avoid heavy makeup, avoid oil based makeup. Just apply use non-comedogenic products from a very good brand like MAC or Sephora. Don't use very local brands, and remove the makeup as soon as possible. Don't keep put on makeup and sleep. Or as soon as you're done, remove the makeup and apply a good moisturizer. Use uh, good non-comedogenic makeup and avoid heavy foundations and primers and all. That's what I
Mhm.
would recommend.
And heavy makeup can also contribute to acne, as a question by one of
Absolutely.
our viewers.
Absolutely. Heavy makeup is one of the reasons of contributing to acne.
Mhm. Okay, there is one more question. Does honey help with acne?
It might help in reducing the inflammation, but there is no documented evidence. Eating honey can contribute to developing more acne, but application, not sure. I wouldn't recommend any home remedy. I will not recommend because it may work, it may not.
Okay. There is a question by Pooja. Question is, can acne treatments cause dry skin?
That develop if the skin, the dermat will take care of it. Acne treatments, if yes, isotretinoin, oral isotretinoin when you take for acne, that does have a side effect of dry skin. But then most of the dermatologists who prescribe, they make sure they let you know and give you moisturizer along with it and a lip balm along with it.
Okay.
And I'm very sorry, I have to interrupt. I have my patients waiting, so can we just wrap up
Sure,
very
sure. Just
fast?
as a wind up, if you can, tell us closing note, as a closing note, any take-home message from your side, doctor?
Take home message: do not touch your acne, do not pick your acne. Please do not buy any OTC products. Do not get lured by the influencers with millions of followers recommending that. They get paid for it and they really get paid good for it. You are the product, not what they are selling. And visit a nearby dermatologist and see for the degree and keep keep your products at minimum. Do not get lured by Nika offers again and order whatever attractive, and have a good healthy diet, exercise well, have a good sleeping schedule, and that's what our new year resolution should be with the last closing day of 2024.
Absolutely, absolutely. Thank you so very much, Dr. Dimple Modi. It was wonderful talking to you. Wishing you a very successful and commendable year 2025. Thank you so very much for joining
Most
us.
welcome.
And viewers, thank you for your active participation. Stay healthy, stay active, and take good care of you and have a blast today and take care of your health at the same time and have a fabulous 2025. Goodbye. Have a great day.